A new report out today from the March of Dimes finds that after 30 years on the rise, America's rate of premature births is improving, but it's still pretty high. 1 in every 8 American babies is born early. That's 500,000 a year, more than most other developed countries. The March of Dimes gives the country a D, and Michigan gets the same bad grade. When babies are born even just a few weeks early, lungs and brains are not fully developed yet, which can lead to serious health and developmental problems. So the report says that the rate of premature births is so high because of so many elective C-sections performed before 39 weeks.
Pregnancy is not 9 times 4, 9 months times 4 weeks, 36. Pregnancy is full term at 39 weeks of completed gestation. And that's so important for the timing of an elective C-section.
Dr. Mitch DeJonge is a neonatologist at Helen DeVos Children's Hospital. Thank you for joining us.
Thanks for having me.
First of all, let's talk about what an elective C-section is. I mean, tell us more about that.
Well, there are times when, because of previous C-sections or because of the timing of the birth, the decision is made to deliver the baby by C-section. As was presented, ideally that would come after 39 weeks of gestation.
But they have to, you can have this, necessarily, can you ask for that, I guess, and some doctors will do it?
That has been identified as a problem, and in fact that's one of the major sort of identified factors of premature birth that the March of Dimes has been working on over the last several years to try to decrease the number of C-sections before 39 weeks.
The numbers are dropping a little bit from 12.7 nationally to 12.3, but Michigan stays at 12.7%. What's going on here?
Well, unfortunately, there were only a few states that actually dropped. The majority of states stayed about the same or actually increased a little bit in terms of the premature rate. So Michigan, unfortunately, is not the only bad state, if you will.
What do you think needs to happen in order to improve our numbers here?
Well, there's lots of factors that have been identified in terms of contributing to the premature rate. Lack of insurance is one, and Michigan's rate of uninsured pregnant women or women of childbearing age has actually increased over the last couple of years. Smoking has actually decreased, which is good.
Oh, that's good news. Okay, I was surprised to hear that smoking was still a factor, though.
Correct, and that is one of the big factors, and smoking cessation continues to be a very big identified factor with the March of Dimes.
Let's talk a little bit more about health risks. Lungs, brain, those are some of the things that aren't developed properly. I know there are others.
Right. Primarily with very early babies, it's lungs and actually intestines, which can be a very significant problem early on. Later on, when babies are born closer to term, we're actually finding in long-term studies that those babies will have some developmental difficulties and perhaps an increased rate of cerebral palsy.
Hopefully we can turn this around then. Mitch DeJonge, a neonatologist at Helen DeVos Children's Hospital, thank you for joining us.
Thank you.